Hello, everyone, and welcome to the Orientation to Agricultural Worker Health, Identification, Registration, and Reporting in the UDS training. This training is provided by the National Center for Farm Worker Health. Next slide. I will be your presenter. My name is Elvia Anderson. I'm the Special Programs Manager at NCFH. Next slide. The learning objectives for this presentation are understanding how the characteristics, work-related risk, and medical conditions of the migratory and seasonal agricultural workers, or MSAS, population impact healthcare access. Also describe the relationship between patient classification, uniform data system, or UDS reporting, and health center funding. Also identify agricultural industries and tasks that meet the federal definition of agriculture and should be considered when classifying a patient for the UDS reporting. And finally, distinguish between the different classification types for migratory and seasonal agricultural workers. And utilize acquired knowledge to report patient in the UDS accurately. Thank you, Lisa. Next. Now, the National Center for Farm Worker Health is a private, non-for-profit organization located in Buda, Texas, and whose mission is to improve the health of farm worker families. And we're happy to report that this year we are celebrating 50 years, providing training, technical assistance, and resources to those serving agricultural worker families. Thank you. Now, let's talk about the characteristics of this MSAL population. A helpful way to understand the agricultural worker or MSAL population is to examine the latest data from the National Agricultural Workers Survey, or NAS. This annual random field survey gathers information on workers' characteristics, employment, and health. The most recent results available are from the year 2019 to 2020 survey, and we will share in the link in the chat to an NCFH fact sheet that highlights the key findings. And Lisa will share that with you in the chat. Next slide. Thank you. So some general characteristics. MSAs are on average 41 years of age, with most, like 67%, between the ages of 25 to 54. And about 1/3 younger than 35. About 2/3 are male and 1/3 female. Over half are married and about half have children. Employment for MSAs is often unpredictable because it's affected by season cycles, weather, market demands, and everything affects the ability to have work year-round. Most, within 89%, are directly employed by growers or packing firms, while a smaller share, like 11% of the workers, they are contracted by labor contractors. Even if someone isn't currently working in agriculture, when they visit your health center, they may be still identified and report as agricultural workers if they have worked in agriculture within the past 2 years. At some point in the past 2 years. Regarding income, about 20% of the MSAs earn below the federal poverty level line, with an annual household income of less than $30,000. Next slide. In regards to work hours, well, they work long hours. 42% of the workers work more than 8 hours a day, and most of the time they work not only 5 days a week, but sometimes 7 all week. Education, the average education attained is the 9th grade. Works type, 28% work with fruits and vegetables, or nuts, and 20% work in vegetables. 24% work in horticulture. In regards to healthcare utilization in 2019, between 2019 and 2020, 71% reported that they use healthcare services in the US, and 26% paid for services out of pocket. Next slide. Now, next we will discuss working in housing conditions and how this affects the workers, their health, and the barriers to accessing healthcare. Work availability depends on the season, weather, and market demand. Hours may be extended like from early in the morning before the sun comes out until late evening. And like I said, sometimes they work more than 5 days a week. Most of the time they work 7 days a week. Income, they get paid by the hour, by the piece they pick, and some are on a salary. 86% of the IMSA households had not received a benefit of a needs-based program in the past 2 years. Next slide. And adequate, affordable, and safe housing has always been and continues to be a challenge for MSAs. For example, only 14% of the MSAs have housing provided by the employer, and they usually live in labor camps during the harvest. Employees know that housing shortage is serious, but building and maintaining camps is expensive, especially for if it's just used during a short period of time. So housing is often substandard. And most workers have been or have to find housing on their own, and rentals, well, they're scarce, especially in rural areas or out of reach due to deposits, credit checks, long-term leases. So many opt to share with coworkers or family members to save money, but this often results in crowded housing, unsanitary conditions that increase health risk and make social distancing difficult. About private housing, well, about 35% of the workers live in private housing, often among seasonal workers or families. And these homes aren't regulated, so they can be expensive and substandard. Again, because they don't have much space. If they get sick, they don't have space to quarantine or practice social distancing so that we can protect the rest of the family if one of them gets sick. And without housing options, some workers end up living in tents, cars, ditches, or open fields. And you might think that this information is old, but in this year, I spoke to a worker who was living in a tent because he couldn't find housing. So it is happening still today. As mentioned in the previous slide, much of the housing available to MSAs is deficient, crowded, and unsanitary, which increases their health risks. Some common illnesses related to housing we often see are included UTIs, intestinal parasites, skin condition, respiratory conditions, infectious diseases. Again, crowded housing makes it challenging to practice social distance recommendations, and this increases the risk for the workers to get sick if somebody gets, for example, the flu or other infectious diseases. Next slide. Thank you. Now we will discuss the risks associated with agriculture as an occupation, the workplace environment risk, and the regulations or lack of regulations in place to protect MSAs. Next slide. So work-related risk. Agriculture is constantly ranked as one of the 3 most dangerous occupations in the nation. In 2020, 368 MSAs died of work-related injuries. Next slide. Many worker injuries are tied to the type of work people do. Musculoskeletal issues, for example, carpal tunnel, shoulder problems, sprains, back pain are very common. The way the farm work is organized is also adds to the risk. Long hours outdoors increase the chances of heat stress, dehydration, and even insect or snake bites. Now, piece rate pay pushes workers to work faster and skip breaks, which means they're less likely to take care of their health, and they don't keep up with medical appointments. So you might have some patients that you schedule an appointment, but they don't show up because of this situation. Now, transportation is another concern. Many workers rely on crew leaders for rides, and sometimes the vehicles are overcrowded or unsafe. They might not have seatbelts for everybody. And because so many workers migrate, they face a high likelihood of accidents over the road. Next slide. MSAs often work directly with soil and plants. This close contact puts them at risk by being exposed to pesticides and chemical fertilizers. Some plants, like tobacco and strawberry leaves, can also cause skin irritation or allergies. Uh, there are even some reports of MSAs using irrigation ditches or runoff ponds for drinking or washing when there's no safe water available for them. Contaminated water and pesticide exposure can cause serious health problems such as eye infections, stomach illnesses, cancer, infertility, birth defects, development delays, and neurological issues. And these chemicals can also reach family members through residues on their clothes, their shoes, their tools, or skin. And when clean drinking water, toilets, and hand washing stations aren't available, the chances of getting sick go up even more. Next slide. Now, to address some of the work-related or professional and workplace environmental risk, there are 3 regulations that have been put into place specific to agricultural workers. The first one is the Department of Labor put in place a Migrant and Seasonal Agricultural Worker Protection Act in 1983. This one establishes the rights of MSAs and the guidelines labor contractors must follow. The second one, OSHA put into place the Field Sanitation Standard in 1987. This one applies to in all states and requires the availability of potable water and sanitary toilet facilities. OSHA has regulations requiring agricultural employers with 11 or more workers to provide drinking water, hand washing facilities, and toilets for their workers. However, farms with 10 or fewer workers are exempt from these requirements. This exemption is intended to avoid placing an undue financial burden on small farms. However, these fundamental amenities are not required by law for many MSAs, regardless of the condition or hours they face in the fields. And the third one, the Environmental Protection Agency put into place the Work Protection Standard in 1992. This one is a federal regulation designed to reduce pesticide exposure by requiring safety training, notification of pesticide application, use of personal protective equipment, restricted entry intervals after pesticide application, decontamination supplies, and emergency medical assistance. But if you notice, all of these were put in place like in 1983, 87, 80, and 92. It's been a long time. So maybe some of you have not been even born then. So we're kind of behind. And not only that, it is also important to remember that enforcement depends on the size of the farm and the entity responsible for enforcing in the area. Next slide. Now, work-related health and safety. MSAs are excluded from several basic labor laws. They cannot organize or bargain collectively under the National Labor Relations Act, and they don't receive overtime pay over the Fair Labor Standards Act, except in California. MSAs are also covered by only 7 of the OSHA safety standards. And the only state that does have a law is in California, like I mentioned. Governor Jerry Brown signed a 2016 law that granted MSAs strong overtime rights and an agreement allowing them to organize. But many other states do not offer this protection. So overall, this means MSAs have fewer workplace protections than other workers. Next slide. Now let's talk about the medical conditions commonly experienced in the population. and the barriers to accessing healthcare. Next slide. So analysis shows that MSOS often report lower rates of chronic diseases than other groups, but many health issues may go undiagnosed because they have limited access to care. So that doesn't mean that agricultural workers don't have these chronic conditions, like you see in the slide. On the contrary, they do have allergies, asthma, hypertension, diabetes, obesity, and cardiovascular disease. So they do have those. However, because they don't go to the doctor often, that's why they are not diagnosed. And the biggest challenge for MSOS with a chronic condition is they cannot stay on top of their managing this condition because they move for work or they don't want to miss work to continue with their health care treatment. Next slide. Now, oral health has been ranked as one of the significant health problems facing MSOS, as well as one of the most unmet needs for them. MSA children are more likely to have decayed tooth surfaces than US school children. Many adult MSAs do not seek oral health care until there's an emergency. So, yeah. Next slide. Mental health is also a concern for MSAs. Factors that affect include traveling alone, being separated from family, limited childcare, lack of education and nutritional programs for children, and food insecurity. MSAs may be hesitant to talk about mental health issues too because they have stigmas or because of cultural traditions. They might not seek treatment, but they do suffer from anxiety, depression, substance abuse, and domestic violence, post-traumatic stress disorder too. Next slide. This slide discusses the barriers that agricultural workers face to accessing healthcare. Long work days and constant travel make it hard for MSAs to stay healthy and get medical care. Many have family incomes below the federal poverty level, forcing them to choose between paying for healthcare or meeting basic needs. Most lack health insurance, so they often only seek care when it's absolutely necessary, when they have to go to the ER. Preventive care is usually not a priority. Sick leave is rarely available to them, so taking time off can risk their job. Language is also a barrier in low literacy that can make accessing care difficult. Now, cultural traditions, they might rely on home remedies or may delay medical treatment. MSOS are often unfamiliar with the US healthcare system also, so they may not know about some services available to them or how to access them. Transportation is also a challenge, especially in rural areas where there's limited public transportation, share rides, or things like that. Next slide. Now, these are system level barriers. Labor policies that lack paid time off or sick days, community and workplace barriers, limited healthcare sites, exclusion from public and private health insurance, lack of awareness about challenges faced by agricultural workers among public health officials and healthcare providers. Next slide. And how are health services delivered to MSAs, the MSA population? Let's talk about that. Next slide. So grantees receive federal funding from the Public Health Service Act Service 330 to provide services for people in the community, and 330G specifically for the migratory and seasonal agricultural worker population. Although the size and scope of services vary by center, most private comprehensive care within their networks. It's not uncommon for health centers to offer basic on-site services and then refer patients to a larger clinic within their network for additional services. But as a rule, the larger the budget, the more comprehensive services a health center can offer. At a minimum, these include a wide range of diagnostic and support services required by the federal government. For example, we see the ones that are listed here on the slide, which are preventive health services, uh, primary health services, preventive emergency services, pharmaceutical services as may be appropriate for particular centers, ancillary service too. And outreach and patient support services are essential for MSAS. As we discussed, MSAS face many barriers to primary health care, long work hours, limited transportation, and more that we already discussed. So health centers can help by providing services that make it easier for them and their families to access both healthcare and social services. Next slide. So now let's review the 2024 Uniform Data System or UDS trends. So we have seen a steady increase in the number of MSAs served in the health centers since the Increased Access to Care program was launched in 2015. If you notice, in 2015, there were less than 1 million workers served. But in 2021, we surpassed our half milestone of 1 million MSAs served. Unfortunately, the 2022 UDS data showed a decline, but we're excited to report that since 2023, over 1 million agricultural workers have been served by health centers. So thank you so much for your hard work and reaching out to those agricultural workers in your communities. Next slide. Oh, and also we're going to share the link. Lisa's going to help me share the link to this data. Thank you, Lisa. So now we're going to discuss the identification, registration, and reporting in the UDS. Next slide. Very good. So it is important to identify patient as part of a special medically underserved population. The federal government recognizes certain groups that face barriers to healthcare and provides funding to support services for them. And these include homeless individuals, MSAs, veterans, patients at school-based health centers, patients at health centers located near or in a public housing. But it is important to identify all of them, not just the migratory seasonal and agricultural workers. Right? So, apologize, I missed my slide, putting it back together. Okay, the UDS stands for the Uniform Data System, a government-required electronic reporting system for health centers funded under the Section 330 of the Public Health Service Act. This includes community health centers and programs for special medically underserved populations. The slide shows the types of information that are reported, which are patient demographics, services provided, clinical processes and results, types of staff employed by the health center, types of funding and payment received by a health center. Now, why? Why is it important to accurately report in the UDS? Well, it keeps us in compliance with federal requirements, and it also shows accountability and ensures a good return on investment, helping secure continued funding for the health center. Next slide. So when a health center applies for funding, they will include in the grant application the number of MSAs they plan to serve. If they receive the funding, they also acquire several obligations. Among those obligations are compliance with program requirements, providing services to the target populations, and submitting reports. If the health center is able to be in compliance with the program requirements, establish an identification and verification process, shows that the funds were used to provide services to the people they were intended for, and submit the reports on time, then the likelihood that the health center will receive funds again is pretty good. Next slide. And who reports what and where? Well, to answer these questions, we must refer to the 2025 UDS manual, and this link to this manual will be shared with you in the chat. The manual shares that the health centers that receive Section 330G funding must provide separate totals for migratory and seasonal workers on lines 14 and 15 of the UDS report. And line 16 will be the total of these two. For other health centers that do not receive 330G funding, they report their total migratory and seasonal agricultural workers patients in line 16. All health centers report these agricultural workers regardless of if they receive or not direct funding for the special medically underserved population. Like I said, in the chat, we share the link. Thank you. So when we identify a patient or family member as an agricultural worker, we are verifying their status as part of a medically underserved population for the UDS report and documentation. This does not affect their eligibility to receive services. Everyone can receive services at your health center. A patient may qualify for a sliding fee discount based on income and depending on the program, the health center's programs, but their classification as an agricultural worker does not determine their eligibility to receive healthcare. Next slide. To verify migratory seasonal agricultural worker status, you need to know three things. One is the definition of agriculture, HRSA's definition. You need to know the type of industries and tasks in agriculture that are included under the HRSA rules, and the classification of agricultural workers. So let's break these and go into detail. Next slide. First, let's see the definition according to HRSA. So this slide includes the exact language for the definition of agriculture as defined in the legislation. Basically, it involves everything from prepping the soil, seeding, planting, growing, picking, packing, and transportation of the goods. Agriculture means farming in all its branches, including crop production, animal production, aquaculture, and supporting activities that is involved with those industries. It is also specific to HRSA, and definitions may vary among other entities and programs, such as a migrant education program and other organizations that serve agricultural workers. Next slide. In addition to the definition of agriculture, HRSA has defined the three classifications of agricultural workers for UDS reporting. It's the migratory worker, the seasonal, the age and disabled. So I'm going to read it directly from the slide. A migratory worker, the principal employment is agriculture, employed within the last 24 months or 2 years, established a temporary home for the purpose of working in agriculture. The seasonal is principal employment is agriculture on a seasonal basis. Employed within the last 24 months, 2 years, is not a migratory worker because he or she has not established a temporary home in order to work in agriculture. The aged disabled, well, it's a former migratory agricultural worker unable to work in agriculture due to age or disability. So this is a definition. Thank you. Next slide. Now let's break down the tasks and industries that are included in HRSA's definition of agriculture. And for that, we're going to examine the NICS codes. Next slide. So the North American Industry Classification System, or NICS, was used to develop the definition of agriculture. and it includes the tasks and industries. So the codes included are the 111, which is a crop production, the 112, which is animal production and aquaculture, and 1151 is the supporting activities for crop production. The code 1152 support activities for animal production. So when we are finding that we are in doubt about whether a task or industry falls into the definition of agriculture, it's good that you go to these codes and do a search of the industry to see if it falls into the agriculture definition. And Lisa is also going to share the link with you. But if you still have doubts, you have questions, you're welcome to call us. We will share our contact information. That way we can help you with this. Next slide. Now the 1-1 crop production code. This includes, you see in the slide, the different things that it covers, like grains, nuts, fruits, vegetables, nursery, including non-food plants, and other commodities like tobacco, cotton, hops, and Christmas trees. So all of this crops are included in one of the 111 codes. Next slide. So now we have the 1151, which it has activities that support the crop production. And one of them you see in one of the slides is harvesting by machine. So if you have a patient who works driving a tractor while they're harvesting fruit, vegetables, that is considered agriculture. A person who works in post-harvest activities like sorting, packing, processing on a farm, very important, on a farm, and that person has the industry of agriculture, so it will be classified as a agricultural worker. Also, farm labor contractors and crew leaders are included, cell preparation and cultivation, the transportation affiliated with a farm. So two important notes about the 1151 support activities. There are the packing and processing must be done on the farm and not outside the farm. So if somebody buys the products from a farm, they take them and they process the food, that's a different industry. But if it's connected to the farm, they're sorting, for example, in this picture, cucumbers is part of the farm, it is included. Also, transportation is, if it's a contractor, it's not, that's a different industry. It's not part of an employee from the farm. That person is not under this code. That's a different industry. So those two things to keep in mind. Next slide. Now let's examine the 112 animal production in aquaculture. As you can see, it includes dairy farms, animal farms, poultry and hatcheries, fisheries, fish farms are included. One thing to remember that if a patient says that they work with fish, make sure to ask what the employer is, because if they go into deep sea, that is not agriculture, that's a different industry, because the fish are naturally occurring, right? They're in their environment, but they were not raised or produced in a farm under the care of human, basically. They're out in the wild, that's a different industry. Next slide. Also, under the 112, other animal productions that sometimes we might not think that they are agriculture is raising animals. That is a commodity. So some type of animals that we see here is horses, donkeys, llamas, rabbits, like fur-bearing animals, lab animals like the mouse that you see there, companion animals, dogs, cats, birds, bees, crickets, worms. So that is also part of the 112 production of animals. So something to keep in mind. Next slide. Now, in the 1152, support activities for animal production include the boarding, branding, reproductive services like breeding, insemination, semen collection, livestock spraying, cleaning. So that is also included in agriculture under the subcategory 1152. Next slide. Now, in addition to being familiarized with the industry where agricultural workers work, it is important to be aware of the tasks they perform because they may not self-identify as an agricultural worker. They might say, oh no, I work in the strawberries, or no, I work inseminating cows. So, it's good to be familiarized with the tasks that they perform so that we can identify that family and report it in the UDS correctly. So this slide contains many words that you can read and be familiarized with them. Next slide. Now, it is also important to be familiar with industries that sometimes you think fall in a gray area because you don't know if it is agriculture or not. Some examples are here in this slide. For example, meat and meat packing companies. That's a different industry. I have talked to people that say, no, I do work with cows. And then when I ask more questions, it turns out it was a meat company, meat processing company. So just because a person works with the live cow, that doesn't mean it's agriculture. That's a different industry depending on who or where the person works. The same with landscaping. Sometimes when you're asking questions to the patient, you might think, oh, it is agriculture, but once you start asking more questions, it turns out they work in landscaping, which is a different industry. You see the industry code there, and that landscaping services is not agriculture. So if they say I work with trees or flowers or plants, let's dig deeper to identify the person as an agricultural worker or maybe not. Also, horses. So we talked about racing horses. It's a commodity. However, when it's work at a spectator, sporting spectator, like in the races, that is a different industry. So it doesn't fall into the agricultural definition. You see this, the trucking timber company, that's a different industry. So even though Christmas trees or some type of that in work, it is agriculture. Transportation of that is a different industry, so it's not agriculture. So again, if you have doubts, questions, you can always contact us. We will be happy to help you with that. Next slide. Now we will cover the MSA verification process and that we recommend health centers to use for accurately classifying agricultural workers. Slide. So there are 6 steps to identify or verify the status of a worker, and you see them here. Step 1 is establish the occupation. Step 2, determine the time frame. Step 3, we determine migratory status. Step 4, we determine seasonal status. Step 5, we identify former migratory agricultural workers. And step 6, we identify all family members. So we're going to go into detail for each one of these steps. Next slide. The step 1 is establishing occupation. And for that, we ask the verification question. Have you or anyone in your family worked in agriculture? Well, verifying questions should be included in the registration forms. We recommend that you do that. It is also important that you have policies and procedures in place to reflect these definitions and verification questions. So if you notice that your form at the health center don't include these questions, we recommend that you add them, and we have resources for that too. If you need them, you can contact us and we can provide you assistance with that. Step 2 is determine time frame. So the verification question is, have you or anyone in your family worked in agriculture in the last 2 years? Now, there's no specific amount of time in agricultural work that the work must have done in agriculture. It could be 1 week out of the 24 months, a month. That is not important. The key is any time within the last 24 months. And due to the nature of agriculture work and seasonal variations, some agricultural workers will work in other industries outside of agriculture for the income. So you might have a patient that when you're registering that patient, he might be working in construction or landscaping, but maybe 6 months ago he was working picking apples. So the time frame doesn't matter as long as you ask the question and the answer is yes. Next step is step number 3, determine migratory status. So the verification question is, have you or anyone in your family established a temporary home in order to work in agriculture? So it is important to remember that the distance a person travels to do agricultural work, that is not important. What matters is if the person must establish a temporary residence or home to work in agriculture. So it's the housing part that determines the status, not the distance. For example, there's large states like Florida or Texas where you don't have to cross borders or go to another state to work in agriculture. Some people that might, let's say, live in Central Texas, they go to South Texas or the Rio Grande Valley to work in agriculture. They have to establish a temporary home because it takes 2-3 hours to get there. So it's obvious that they had to establish a temporary home. And if that happens, then you will classify them as migratory workers. But if the person didn't have to establish a temporary home, then that is a seasonal worker. So we're going to see that in step 4. So step 4 is determining seasonal status. The verification question is, have you or anyone in your family worked in agriculture or on a seasonal basis without having to establish a temporary home? Also, do your job, hours, task, or income change within the season? Because remember, just because a person works for the same farm the whole year, that doesn't mean they do the same thing every day, the whole year. The task is going to change, the pay is going to change, the amount of work or days they work is going to change. So if you have a patient like that, you can classify them as a seasonal agricultural worker. So what does a seasonality mean? Seasonal work in agriculture isn't clearly defined in the law. Unlike many jobs, agricultural work is unpredictable, affected by weather, crop demand, work source, and disasters. So seasonality means a worker's job, hours, task, and income can change at any time in the year. So even, like I said, even if the person works full time or it looks like he works full time for this employer, that doesn't mean that he's not a seasonal worker because, again, everything changes throughout the year. Next step. Now, step 5 is identify former migratory agricultural worker. So the question is, have you or anyone in your family stopped migrating to work in agriculture because of a disability or age? So the Consolidation Act of 1996 expanded the definition to include age and disabled former agricultural workers who stopped migrating due to age or disability. Some patients may have been both migratory and seasonal earlier in their careers, so it is important to ask if they ever migrated to work. If they did, classify them as age and disabled. This does not apply to seasonal workers, but it applies to the ones that used to migrate for work. And then if you have a patient like that, you can classify that patient as a migratory and agricultural worker. Thank you. Next slide. In step 6, identify all family members. So the Consolidation Act of 1986 also expanded the definition to include family members. All family members of a verified agricultural worker are considered agricultural workers, regardless of they have insurance or not. Dependents should be classified as migratory or seasonal, just like the primary worker. This includes children. For age and disabled former agricultural workers who stop migrating due to age or disability, both they and their family members are classified as migratory. Health centers decide who counts as a family member. Since MSAs often live in multi-generational or shared houses, policies should reflect this, and all staff must follow them to accurately and consistently report on the UDS. So, the health center decides or should have a policy of who constitutes a family member. Next slide. Now we have some tips and strategies for you. That way you can classify and report correctly. The first one is to implement policies, procedures, and staff training to ensure that staff understand the population and how to accurately identify and register them. So I know it's time consuming, but it's important that new staff or new members receive this training immediately, or even have this kind of training annually for experienced ones, even independent, because again, we need to stay up to date with what the procedures and how to register this population. Also, ask the right questions on the registration form and assist. Sometimes if we just put, do you work in agriculture? They might say no, because they don't think that working in a dairy farm is agriculture. They might say, no, I don't work in agriculture. Well, assist the patient so that we can classify them correctly. Make sure that all patient or guardians are screened for MSA status and other special medically underserved populations, regardless of insurance or employment. So just because they have insurance, don't assume that they don't work in agriculture, or their parents, if it's a child. Verification should happen at every visit, and we recommend this because maybe when you saw the patient 6 months ago, they were not working in agriculture, but now that they come back, they are, or they worked sometime in between that time. So verification should happen at every visit. Also, have additional tools available for the front desk staff that can use, for example, a list of agricultural employers around the area. That way, if the person doesn't know if they work in agriculture, they can say, oh, you work for so-and-so, or you work at this dairy farm that is from, whatever. And then that will help also register and identify these workers. A cheat sheet illustrating common tasks, that will be helpful too. Cross-reference adult MSAs with family members who are patients of the health center, and the electronic health records. So that way you have a real accurate count. Next slide. Now, how to ask the questions. This is also very important. You're going to notice in this, it's the same question, just asked differently to help the patient when you're helping them register. So use the easier terminology or how they identify. For example, the question is, have you or your family member worked in any type of agriculture in the past 2 years? Or have you or a family member worked in the fields in the past 2 years? Have you or a family member worked in a farm in the past 2 years? You get the idea. You change the word so that the patient can understand better. So those are some of the recommendations. Next slide. Now, what if the patient is reluctant to answer? Because, yes, they have the right to be reluctant to answer our questions, especially when they're there to see a doctor, and now that we're asking them where they work. So ask the patient the question in another way. Who do you work for? And also be patient and polite. That will help also. What is the name of the company where you work, or what type of work do you do? And then also let them know that you need that information because you want to better serve them or because you have a special program to assist them. But make sure that they know that their information is confidential. That way they feel more, uh, they're able to answer our questions. And thank you. Next slide. So we're at the end of the presentation. We thank you so much for listening today.